Chemotherapy is a cancer treatment where medicine is used to kill cancer cells. Targeted molecular medical therapies are drugs or other substances that work against cancer by interfering with specific molecules that are involved in the growth, progression, and spread of cancer. Both treatments can also have an effect on healthy cells, which may lead to complications such as fatigue, may be due to anemia, other effects of cancer and/or treatment, including the time treatment takes. For example, these treatments can require a more regular attendance at hospital for several weeks or months. The appointment itself may only take minutes, but unless you live nearby and/or have your own transport, each session can involve travel and/or a whole day out. Bone marrow suppression. These treatments can have an effect on how well the bone marrow continues to produce blood cells. We need healthy blood cells to deliver oxygen and nutrition around our body, help fight infection, and also repair damage and prevent bleeding. If bone marrow production of cells is reduced, this can lead to anemia, reduced immunity, delayed healing, and bruising or bleeding. Altered liver or kidney function. Both the liver and kidneys are involved in the regulation, filtering, and elimination of waste products in our bodies, including products within the bloodstream. Substances from damaged tumour cells and the breakdown of treatment products, once they have done their job, need to be eliminated from the body, and the liver and kidneys are vital in this. However, sometimes these substances can cause damage to healthy liver and kidney cells, leading to reduced function. Some chemotherapy drugs may also lead to a change in urine colour and/or odour. Nausea and/or vomiting. A sore mouth and/or altered taste and appetite. The lining of our gut, from our mouth to our anus, is made up of cells that are constantly renewing and replacing themselves. Certain treatments may see these rapidly dividing and changing cells as no different to cancer cells, which can lead to mouth ulcers and/or nausea or vomiting. Diarrhea and/or constipation. The effect mentioned previously can also alter how the bowel works. Dose restrictions and/or limitations. If you have previously been treated with radiation and/or chemotherapy, your specialist team will need to consider whether these previous treatments will affect planned treatment. Some drugs may have a lifetime dose limit. Other previous treatments may increase or reduce effectiveness of planned care. Fertility. Depending on the type of treatment, your fertility may be affected. Some chemotherapy drugs may also lead to early menopause. This may be temporary or permanent. Pain and/or inflammatory response. The body may see treatment as an injury. The natural response to injury is inflammation, caused by a rush of protective and repair factors to the site of harm. The tumour doesn't want to be killed, but as its cells are attacked, it may release certain substances that cause inflammation and swelling, which can lead to discomfort and/or pain. Rarely, a more severe reaction may be experienced as tumour cells are damaged and die. This sudden destruction can cause the release of certain chemicals into the bloodstream that the kidneys cannot get rid of as fast as they'd like. This is called tumour lysis syndrome. Typically, onset is within 1 to 5 days of the procedure or chemotherapy, and severity can range from a few abnormal blood results to the other extreme, which may include renal failure and cardiac disturbances or heart problems. Hair thinning or loss. Nail and skin changes. Hair anywhere on the body, skin and nails, and the lining of the gut are made up of cells that also rapidly divide, renew, and replace themselves. Therefore, as in the gut, you may see changes in your hair, nails, and skin. Once treatment has completed or stopped, these cells can recover and normal growth restarts. Interactions. Certain other medications and/or food substances, such as grapefruit juice, may affect how well your planned treatment works. Some can increase their effect, and others may reduce their effect. Your specialist team will advise you on this. Allergy and/or severe intolerance. Very rarely, an allergic reaction to treatment may occur, which is why some treatments may be started under close medical supervision. It may not be the drug itself, but may be something in its preparation or content. For example, some people cannot tolerate medications that come in capsules, the type that can be opened rather than shape. Any severe reaction should be considered a medical emergency. If not in hospital, then you would be advised to call 999 or attend A&E, or the nearest medical services as soon as possible. You will be given self-care advice, and this will include how to best prepare for treatment, self-care during treatment, including when to seek medical help and what to expect afterwards.